that. Now, today we are doing things a little different here on Weekend at 1. So yesterday, the Cabinet Secretary in the Ministry of Health told Kenyans how a group of 8 fake mourners bought a coffin, strapped it onto the roof of a car and hired a driver to take them from Nairobi to Homa Bay to escape the COVID-19 containment measures in the city. The irrationality of the fake mourners illustrates a growing level of indiscipline that is putting the lives of millions of Kenyans at risk of contracting COVID-19. That irrationality is spreading the disease and putting the lives of about 28,000 Kenyans at risk, Health CS Mutahi Kagwe announced on Saturday, signaling how missteps by the population could plunge the country into medical anarchy in the coming weeks, with the number of positive cases in Kenya now at 262. So the whole world is talking about this virus, but what does it take to test it? What happens when one tests positive? What really is contact tracing, and why is it important? Now, Dr. Mercy Korir is taking that all-important test right now and is asking all the questions you may have on COVID-19, and that is our focus this afternoon. Dr. Mercy is live for us from the Lancet Laboratories. Good afternoon, Doc. It's great to see you. All the best, of course, but of course, talk to us about how you prepared for this test, Doc.
Well, Grace, it is a scary moment, if I must confess, because the test could go either way. It could either be positive or negative. Obviously, I'm hoping that it is negative because it means then I'll be able to go home. But before coming in here, when I had discussions with Dr. Kalebi, and we'll introduce him a little bit later on, he categorically told me that, you know what, if the test turns positive, it has to be reported to the government of Kenya, and I cannot go back home. I have to go to isolation. So I came prepared, obviously, to stay in isolation, a bag of toiletries, my work bag, and everything, so that just in case I'm going into isolation. As you can see, I do not have any symptoms. I've not been sick, but because of the nature of work, being a journalist, being in the front line, being out there and interacting with people, then it means I could have met any number of people. So one of the first things I did was to prepare my travel bag and make sure that in case I need to go to isolation, then I'm ready to go to isolation immediately after testing here at the Lancet Laboratories. Now, the other thing, and this, my colleagues, including yourself, although I've not met you in a while, was to do a list of all the contacts I've met in the last 2 weeks, because what this means is if I test positive, then everyone on that list becomes a potential risk, and they'll need to either go into quarantine and get tested, and if they get tested and they're positive, then they need to go into isolation. So in a nutshell, that is what happens for anyone who tests positive, or anyone who for some reason suspects that they have coronavirus. One of the first things to prepare is a physical preparation to stay in isolation. Know the people you've met over the last 2 weeks who could be the potential contacts. Now, the one that was really hard to prepare for was psychologically. It took a lot for me to actually psychologically prepare to come and have this test. You know, we've been seeing that you have a swab up or down the nose, as Dr. Kalebi will explain, for the sampling. Many have said it is not a comfortable, so it's not so comfortable. It's a little bit uneasy, and I'm ready. So I have some tissues here, because some people have sneezed, some have a gag reflex, and so we'll be doing just that now. So Dr. Kalebi will explain to us how we'll be getting that lab sample from, and how and what to expect. Dr. Kalebi from the Lancet Pathologist is a pathologist and has been doing some of the tests by the government. He's done 1,300 tests as at now, and so we'll be explaining. So I'll be practically taking this test. Every time I think about it, I freak out a bit, but yeah, Dr.
Yeah, so basically what's going to happen here now is the sample will be collected from the nose, actually from the back of the nose, and another one from the back of the mouth, what we call nasopharyngeal swab, and oropharyngeal swab. And Dan, who is one of our phlebotomists and well prepared for this, will go ahead and do it. Dan, please proceed. Okay, so Dan confirms that all the details you have given are correct, because we need to capture your ID number, your date of birth, your details, your residence. because these are all information that will be important for follow-up. So that in case you are negative, then there's no issue. But if you are positive, then there is a public health protocol to be followed. I just wanted to correct that not everybody is taken to forced isolation or forced quarantine. There are people who can have home-based isolation and home-based quarantine if they meet certain criteria that the government has to allow for isolation and quarantine. So Dan, you can go ahead.
Okay.
Just
do two swabs.
So Dan is going to collect 2 swabs. And basically what he has is the swab stick. It's in a container. And once he removes it, ideally he should label everything before he does that, because we're doing this for the camera as well. So he'll label it immediately after. And as he removes it, just go ahead, Dan. As he removes it, just show the camera what it has, the tip. The tip has this cotton, almost like an earbud. And it has what we call a Dacron material, which does not interfere with the virus. We can't use the cotton wool earbud type, because this is a special type of swab that is prepared not to interfere with the RNA from the virus. So he's going to go ahead and collect the one from the nasopharyngeal. And essentially what happens is he goes not up the nose, but down the nose. Go ahead. And it's basically a gentle push through the nose. It can be a bit uncomfortable, a bit of discomfort, but not quite painful. I'm sure Mercy will tell us once she's done with it. So he goes gently as far back as possible, and he's basically turning it around to collect the sample, and I think that's enough. So that is one sample already. Then he'll collect from the back of the throat. We usually collect 2 swabs, because the reason why you're collecting from the back of the throat and the back of the nose is because that is where the virus multiplies. It's a respiratory virus. Yeah, for some people, it might not have enough. Yeah, I can see you're tearing a bit because of the irritation.
Yeah, it's not painful. Yeah, okay. People should not be worried that I'm tearing. It's not that it's painful. It's uncomfortable. It's not a nice feeling. Yeah, but it's not a nice feeling. Okay. All right. So then the throat one. I hope.
So in this case, Dr. Mercy is being told to say and the swab is going right at the back of the throat, near the tonsils, and basically what Dan is doing is taking a swab from the back of the throat, because that's where if there is a virus, if there is COVID-19 virus, the SARS-CoV-2 virus, that's why it's multiplying. And then he puts it in the container, and since this is going to be run immediately, then he'll pick it and take it immediately to the lab. However, if it's being collected from a far site, then it requires what you call a special transport media. So basically, that's the process takes less than 2 minutes, literally. Yeah, maybe you can tell us about your experience. How does it actually feel? I've had it myself, and it was quite okay.
It's uncomfortable, and it leaves an irritating feeling at the back of the nose.
Because you're not used to things going back.
Yeah, and so I think I'm going to have a running nose for some time.
No, not necessarily.
Maybe for a few minutes, but yeah, it's uncomfortable, but yeah, I think it's not an experience I want to go through again. But yeah, I think we'll get to know those results after how long?
After 3 hours. So basically it takes about an hour to prepare the sample, and then 2 hours to analyze it. So within 3 hours you should have your results. And then once you have your results, we usually will relay it on email. But if it is positive, we actually call you or call your doctor for that matter. But because you're a healthcare worker, for healthcare workers, they can walk in straight and have their test done. But for the general public, we usually recommend that they either go through a doctor to refer them or an institution.
Okay.
Yes.
Have you been seeing many people coming in, healthcare workers, for example, and their families coming in to do this testing?
We have been doing this testing now on site for the last 2 weeks, and the numbers have been quite high. As I told you, we have done more than 1,300 tests so far. Most of the ones that we have done so far are mainly from institutions, from hospitals, patients who are sick. We also have a lot of walk-in people just coming in, but they usually will be referred by their doctors. However, what we have noticed in the last 3-4 days, there's been a bit of a dip, because one of the consequences of testing is when you have positive cases, then what happens to them? And now there's this fear that when somebody is tested, then you are taken to forced isolation, and your family is taken to forced quarantine. So I actually have doctors and other healthcare workers who are saying, I have symptoms, but I'm not going to come for testing because I know if I get tested, I might be forced into detention, as they call it, and I think that's a worry.
But yeah, this is a worry because this may have some dire consequences, because if we have people who are symptomatic, particularly healthcare workers who are the front line and are at risk of contracting the virus, if they are, for example, even symptomatic or asymptomatic without any symptoms, and they have not been tested and found out, then you cannot isolate. Then it means people are still walking around and being quote-unquote super spreaders. Isn't this a cause for alarm?
It's a big concern, actually. It's a big cause for alarm. What the doctors are actually saying is if they are symptomatic, they'll go and isolate themselves for 14 days. But we know that the virus can actually take a while before it starts shedding. So the 14 days is not sure proof. Number two, you might actually not even have the virus. So I think it's very important that people test. And there is free testing under the government, under this mass testing. I know the uptake has been poor, and I think one of the things is to destigmatize COVID-19 and make people realize it's just another virus that you can test. Most people will be asymptomatic. Most people will be fine. The key issue is not to spread it. So I think the issue of testing, isolating, tracing is important. And I know for a fact that a lot of the some of the people who have come here, they have been able to manage to organize with the government for home isolation, for home-based quarantine, without a problem. So this issue of detention... You should have
told me that,
yes.
So that I wouldn't have packed my bags. When you told me I would categorically go to government isolation, so I've been psychologically prepared to go to Mbagathi.
No, you are the one who read about it, not I didn't tell you that. And I'm sure if you talk to people like Dr. Lois, Dr. Abdi from the Medical Council, they'll tell you that because the options are there. And there's a criteria that is used, as far as I know. For the people who have a home where they can have isolation, they'll not mix with other people. Obviously, it's better than going to a facility which might be uncomfortable. But if you don't have the facility to be able to isolate and quarantine, then it means you have to go for the government-provided isolation centers. Yes.
Okay, so now just explain to us, let's say my result turns positive.
Yes.
What is the process of informing the government and what steps will happen next after that?
So immediately the result is positive. Once we pick it up, we inform both the doctor, the primary doctor who referred the patient, and we also inform the Emergency Operations Center for the government, which is headed by Dr. Kasera. We notify them and we give them all the contact details, and usually they'll get in touch with the doctor and the individual who was tested, who was found to be positive. We also have a daily report that we send to the government every morning around 6 that gives a status report of all the cases that we have done. And I believe all the other labs that are doing similarly will send this data, and then the government acts on it. Most of the time when the results is out, I think within a few hours, there's this team that traces, and they'll come and they'll discuss. And initially, I think there was a bit of bad press in terms of the way it was being done. People thought it was, with the police and all that.
But is it bad press or actually what was happening? Because we have had people being, quote-unquote, roughed up in the middle of the night, police come in, ambulance and people with hazmat suits to come and, pick you up. So it's not really bad press, but actually what was happening, which is part of, I think, what was stigmatizing people identified to have coronavirus.
You're absolutely correct. It's not bad press. It's not the press who sort of portrayed it badly. I think it was the way it was being handled. And actually what I'd like to urge, particularly healthcare workers, they're the highest at risk for themselves and also highest at risk to transmit to others. And I think ideally right now we should be getting healthcare workers going in droves. Kenyatta is offering testing for free across the Cambridge sites. I think we really need healthcare workers who are in the front line to be testing more often. And I want to commend you for coming for your own test. And of course, there's also testing for anybody who is symptomatic, who has respiratory symptoms. You can go to your doctor, show your concern. And nowadays, doctors are doing electronic consultation. There's no visiting to the clinics. And the doctor will refer you. In other countries, we even have asymptomatic people who come for testing. You don't actually have to have symptoms. And we know more than 50% of COVID is found in asymptomatic people in countries where they're testing asymptomatic people as well. Yeah.
So in terms of contact tracing by the government, you may know a thing or two. How do they reach out to the person who has been diagnosed or who has coronavirus? How do they reach out? And so, like me, who has a list, should everyone start preparing a list of people they've met?
If I was to be asked, I think the contact tracing is the most efficient aspect of the entire operations under the government. They are very, very efficient. They're doing a very good job, probably even better than even what the medical people are doing. I think they're using the National Intelligence Service, and they're quite efficient. They'll be able to track and trace the people who are positive, get them, and through questioning, they should be able to even track all the other people who are with you. I don't know whether they're using maybe phone signals and so on, but they're quite efficient, because some of the people that we have tested positive here, I know that within a matter of days, everybody else who was around them have been rounded up for quarantine, and I think that is going on quite well. Yes.
Okay. So let's talk about the tests.
Yes.
You've done 1,300 tests as at yesterday. Are these tests or people tested?
In our lab, these are tests, and I believe in the other labs, when they report tests or samples, these are the number of samples. Now, in our laboratory, we don't have many repeat testing, but I guess for some of the government labs where they're having patients or other individuals who have been retested in quarantine, then the tally will include repeat testing for individuals. So for us, I think about 10% are repeat testing. So 90%, about 1,100 are individuals tested. And you remember, for our case, most of these are low-risk individuals, although some of them are hospitalized patients. So we've had not a very big number. Actually, it's less than 2% in terms of the number of people who have tested positive. Actually, I'll say, around 1.3%.
Are we testing enough?
In my view, no. And actually, I'm a bit disappointed, generally, because with the scale-up in testing by the government, I expected that people will be rushing for testing, healthcare workers, institutions like KPA and the rest, but we are not seeing it. And the capacity is there under the government. The reagents are there now. I think people should actually come out more for testing. That is not happening.
So what are the bottlenecks? Why are we not? If we have all these reagents that initially we say we didn't have, initially we were saying we are testing in South Africa, then we have capacity here locally. We had all of those issues now, but if we have sorted out all of that, and for example, Kemri laboratories are able to test in Kilifi all the way to Kisumu, then why are we not testing enough? What are the issues that are preventing us from testing enough?
I'll say three things. One is coordination, because the people in the lab have capacity and they're ready, but in terms of coordination with the people on the ground who will collect the samples, that's an issue. I know earlier in the week there was issues of PPE lacking, the actual swabs unavailable, and that is being sorted out. Then the second bit is the logistics. It's one thing to coordinate and collect the samples, but the logistics of organizing for those samples to get to the lab. That's the second point. Now, for us, even in our lab here, where we can get people coming in, private paying patients, the third aspect, of course, is the stigma and the persuasion. People are not persuaded to come for testing. As I said, even doctors, they don't want to test themselves and their own families out of fear. And that has to be addressed here.
Okay. And when we talk about PPE, and we could see Dan was in full, PPE, is this always the case, and why?
Yeah, so the PPEs, there are three levels of PPEs. There is what you protect your eyes with, the goggles, the mask, and ideally they should be using the N95 mask because it has almost 100% protection on the virus. And then there is the suit, the hazmat suit. Now that one is good, but it's not necessary for the sampling. For the sampling, even a simple disposable gown will do. Because remember that this SARS-CoV-2 is considered a category +2 biohazard, which means it's not any more dangerous than the other viruses and the TB. Actually, TB is even more dangerous and more infectious. The only problem, of course, is that it can infect so many people, so you don't want it to be spreading sort of in a surge. But otherwise, even when we are transporting the specimens, we don't take any extra precaution other than the standard precaution that we take for this particular virus. It's not like Ebola. Ebola can only be handled in a class 4 biosafety level, 4 laboratory, very high level, because that is much, much more dangerous. The issue here is the infectivity, but otherwise the normal protection is actually adequate, yes, for purposes of sampling and purposes of handling patients in general. Of course, it's another matter when somebody has been confirmed that they are positive and they're under treatment because they are more infectious. So then the full protection is required. But in our case, the normal sampling is adequate, and we usually encourage that people should go and have themselves tested while still in their car, what we call the drive-through, so that way they don't go mixing with other people. Or we actually have a designated place for collection downstairs at the parking. Of course, you being a Sunday, today is a quiet day, so we have been able to attend to you up here. Yeah.
Like a VIP.
You're a VIP, obviously.
Yeah. So finally, Dr. how do you now, as a private laboratory, coordinate with the government, and should we see other laboratories coming? But before you answer that, let's hear Dr. Lois Achieng-Ombajo to just speak to us about the treatment options available for the people who've been confirmed to have